Well, let's shift focus now to China. In a complete reversal in its strategy, China has announced more steps to relax its COVID curbs. In a latest, China's National Health Commission has announced it will be dropping COVID quarantine requirements for international passengers, which includes testing and centralized isolation. Travelers who produce negative test results 48 hours before departure can enter the country without applying for the Green Health Code. The relaxations will come into effect from the 8th of January. However, the NHC spokesperson has said that they will continue to step up vaccination for the elderly and children, and that they will be focusing on meeting the medical needs of the general public.
To robustly prepare health resources with a focus on meeting the medicine needs of the general public, striving out to protect the key groups, including the elderly and children. In particular, we will step up the vaccination of the oldest citizens, and we will earnestly enhance the pandemic response in rural areas. Categorizing and managing COVID-19 as type 2 infectious disease will still need the strong support from the general public.
Well, to take this forward, I'm now joined by Jonathan Cheng, China Bureau Chief at the Wall Street Journal. Jonathan, thank you so much for joining us. First question, Xi Jinping has been quoted to say that there is a new situation facing us with new tasks. We've seen these relaxation in terms of travel quarantine requirements. We've also seen, in fact, public messaging coming in from health officials talking about how this Omicron variant is not as lethal, is not as harmful for the general public. What are we seeing here? Are we seeing China trying to downgrade the effects of this pandemic, of this virus, at a time when there's unprecedented explosion of cases?
Yeah, you're right. The timing of it is certainly unusual. Many health experts have been saying for a very long time that we expected to see China eventually make this pivot, but I don't know that we expected it to happen in the middle of winter. And as you note, Xi Jinping has come out and said that there's a new situation, but this is the first he's acknowledged this reality in the past couple of weeks, because already we've seen quite a shift in policy since the beginning of December. But of course, this just adds emphasis to the fact that China really is turning the corner here and trying a whole new policy. Whether or not it will lead to mass fatalities and whether or not it will work out as smoothly as many people are hoping that it will is another matter.
Sure. Interesting to point out some of the visuals that we're beginning to get out of Beijing and Shanghai. We're seeing public transport fully occupied, people busy on the streets. We're also getting reports from areas such as Chongqing and Xinjiang, where people, despite being asymptomatic or despite having mild symptoms, are being asked to return to work. Is this a situation where the general public perhaps does feel that it's better to, in fact, make peace with this pandemic rather than to have the strict restrictions that we'd seen in the recent past?
Well, you really have both impulses that are quite strong. On the one hand, for 3 years with the zero COVID policy, I think a lot of people were just ready to move on. And on the other hand, you have this message from the government that was so strong for 3 years that this is a virus we have to be very careful about. We have to crush it everywhere it appears. So to try and reconcile those two is quite difficult. And, I think one simple way of trying to divide it is that, if you're younger, if you're healthier, if you've had your vaccinations, if you're reliant on tourism or on restaurants or on service sector jobs for your livelihood, then you're going to have to take those risks because you need to feed your family, you need to feed yourself. Now, households that have elderly people in them, which of course is most households, there may be a little bit of a complication there, and that elderly people in China are the most vulnerable. Many of them have not been vaccinated to the same degree that others have been. And of course, in the depths of winter with people who are 80 years and older, you would expect them to be the most vulnerable in any country, in any situation. And so I went and visited 3 hospitals in Beijing yesterday, went to the ICUs, and there the scene was quite grim. I mean, you really saw elderly people lying in cots in the hallway of hospitals. People are not getting treatment for many hours. They have oxygen tanks, IV drips, and all this other stuff. So, on the one hand, people are going to work, people are going to restaurants, people are going to cafes and bars again. But on the other hand, if you go to the hospitals, you can see that that is also part of the equation here.
So let's also factor in some of the triggers that we're expecting. The Lunar New Year is about 3 weeks away from now. There is an expected move of migrant workers in the millions from infected urban centers to less affluent cities towards the interiors. Is that expected to only aggravate the situation on the ground? The numbers are already overwhelming. Will it get worse?
Well, I think it definitely has that risk. If people are sick at the time of Lunar New Year, they probably won't be wanting to get on a train or on a plane or on a bus because they're just not in that condition. On the other hand, I think a lot of people here have seen Lunar New Year been denied them for the last 2 years, and I think are really, really keen to go home. Now, for many people in China, they work frequently in a province different from the province where they're from and from where their family is. And so many of them, this is the one time of year that they get to go home. And as I mentioned, many of them didn't get the chance to do that in 2020 or in 2021, or in many cases in 2022 as well. And so many of them are going to really want to go home, even if the risks are higher. And of course, when you take the population of China and you do the math, it's a lot of people that could potentially be infected.
Sure. Let's talk about the political overtones here. We initially saw a very tight regime where we had COVID restrictions in place, the zero COVID policy. Then we saw protests being sparked that were likened to the Tiananmen Square protests. And subsequently, we see now a dismantling of that earlier regime, a U-turn of sorts. What does this entail for the political fortunes of Xi Jinping going forward?
Well, it really depends on whether or not they can stick this landing, as it were. You know, I think there's little debate within China. Others may disagree, but there's little debate within China that 2020 and 2021 were very good years for China, with the exception of the initial few weeks in Wuhan when everybody around the world was confused and didn't quite know what this virus was. The rest of 2020 was actually very good. You couldn't leave the country, but you could travel freely, and the economy roared back to life, and that mostly continued in 2021. I think a lot of the frustration that you describe is really from 2022, watching the rest of the world open up, looking at this Omicron variant, which spreads a lot more quickly, but is believed to be less serious for many people. You put that all together, and I think a lot of people in China were wondering all year long, when are we going to be able to rejoin the global economy? When are we going to be able to have our lives back again? And as I mentioned, I don't know that anyone expected it to happen quite as quickly as it did, but whether or not we see more families who lose loved ones, perhaps they feel unnecessarily because things happen too quickly, that will have political ramifications. Of course, the flip side of it is that because Chinese people are going to be very cautious coming out of this, perhaps the number of deaths won't be to the same proportion as in other places, because we've had the experience of other countries and their examples, and we have had 3 years of very, very strong messaging saying, be careful when you're in a public place, take precautions, and perhaps that will work. And maybe we get to the spring, people are feeling good, the economy is coming back, and maybe not as many people died as is feared. So that's really what I think the outlook could be, but we really don't know what exact scenario we're going to get.
Right, Jonathan, thank you so much for taking out your time and sharing your thoughts and some updates on the situation there on the ground. Quite grim there, the China picture, but that's all the time that we have with Jonathan. Thank you so much once again for taking